Now we will be doing point number 376. A patient presented with fever and lymphadenopathy. Investigation shows atypical lymphocytosis. Next investigation to reach the diagnosis is monospot test. Clear? Now we will learn about Epstein-Barr virus. Epstein-Barr virus causes infectious mononucleosis. Monospot test is positive. A heterophile antibodies are positive. Heterophile antibody test is also known as monospot test and Paul Bernal's test, and it causes atypical lymphocytosis. A type of cells affected is B cells, while the atypical cells that proliferate in response are T cells. Hint of the scenario is upper respiratory tract infection and taken amoxicillin or ampicillin which developed rash. Diagnosis is of infectious mononucleosis. Clear? Now the next is following is caused by DNA virus infectious mononucleosis. 30 years old man gives history of a sore throat with fever followed by 6 weeks of malaise. On examination, he has standard generalized lymphadenopathy. A cervical lymph node biopsy is performed and microscopic examination reveals prominent germinal centers in follicles with a diffused polyclonal hyperplasia composed of lymphocytes, plasma cells, and macrophages. What is the most likely diagnosis? It is infectious mononucleosis. Clear? 19 years old present with 5 days of fever, 101 degree Fahrenheit, and sore throat. She also complains of fatigue for the past week and difficulty swallowing. On examination, she has generalized lymphadenopathy and biopsy shows atypical lymphocytosis. What is the most likely cause? It is Epstein-Barr virus. Clear? The peripheral smear of infectious mononucleosis patient will shows activated T cells. Atypical lymphocytosis in a young boy. DNA virus is causing it. It is infectious mononucleosis. A 10 years old boy presented with fever, sore throat, and cervical lymphadenopathy. Peripheral film shows absolute atypical lymphocytes. What is the likely cause? It is Epstein-Barr virus. Next, a 20 years old female presented with atypical lymphocytes up to 20K. Diagnosis is infectious mononucleosis. Now, the diagnostic test for infectious mononucleosis is Paul Bernal's test. It also comes in exams as diagnostic test for infectious mononucleosis is heterophile antibody. The next, a patient presented with fever and lymphadenopathy. Investigation shows atypical lymphocytosis. Next investigation to reach the diagnosis is monospot test. Clear? The next condition which will yield high titer of serum heterophile antibodies is infectious mononucleosis. Clear?